Welcome to this explainer. If you've been following healthcare lately, you already know that GLP-1 weight loss drugs are basically the absolute holy grail right now. But let's be real, with price tags often topping $1,000 a month out of pocket, they are completely out of reach for a lot of folks. Well, today, we're breaking down a little-known federal initiative that could literally change everything for you. I'm going to guide you through the brand new Medicare GLP-1 Bridge program and give you the exact blueprint on how to access these highly sought-after medications for just a fraction of their usual cost.
Okay, let's just look at this number right off the bat. $50. That's it. That is the flat monthly copay we're talking about for premium weight loss drugs on Medicare under this new initiative. For anyone who's ever stared down a $1,000 pharmacy bill, you know this is an absolute game changer. But because this is a government program, you can't just stroll up to the pharmacy counter and ask for the discount. There's of course a maze of red tape to navigate, and today we are going to give you the map to get through it.
So here's our roadmap for today. We've got 1. The $50 Bridge program. 2. Who is actually eligible? 3. Which medications are included? 4. The crucial fine print. And 5. Taking action with your doctor.
Let's kick things off with Section 1, the $50 Bridge program. So the very first thing we need to understand is the timeline, because if you miss this window, you completely miss out on the savings. The clock officially starts on July 1st, 2026, but more importantly, it stops on December 31st, 2027. Why? Well, this is strictly a temporary demonstration program. The Centers for Medicare and Medicaid Services created this to offer a brief window of affordability while the government basically tests the waters and evaluates long-term coverage models. Because it has such a hard expiration date, understanding the urgency here is absolutely key. The window of opportunity is pretty narrow, so knowing how to act within it is crucial.
All right, let's move right along to Section 2. Who is actually eligible?
As I mentioned, there are some strict gateways you have to pass through to secure this pricing, and the very first one is all about your current insurance. Think of your baseline insurance as your VIP pass to this program. You absolutely must be enrolled in a standalone Medicare Part D prescription drug plan or a Medicare Advantage plan that already includes drug coverage. Now, if you have an MA-only plan, which is a Medicare Advantage plan that specifically does not include prescription coverage, the door is unfortunately closed. You're exclusively excluded from this bridge program, so you'll definitely want to check your insurance card before you do anything else to make sure you have that baseline drug coverage.
Now, once you have the right insurance, your doctor actually has to fit you perfectly into one of 3 federal eligibility tiers. Think of this like a sliding scale of health risk. If your BMI is 35 or higher, you're in. No other conditions needed. But as your BMI drops into the lower tiers, the government requires more proof of risk. For a BMI between 30 and 34.9, you have to also have heart failure, uncontrolled high blood pressure, or chronic kidney disease. Drop down to the 27 to 29.9 range, and you need a documented history of prediabetes, a past heart attack or stroke, or peripheral artery disease. It's a very rigid scale, and your physician must prove exactly where you fall to get that prior authorization approved.
But get this, here is the ultimate irony of the entire program. If you actually have type 2 diabetes, moderate to severe sleep apnea, or fatty liver disease, you are kicked out of this specific bridge program. Wait, why would they exclude people with severe conditions? Well, it's actually because individuals with those specific diagnoses are typically already eligible for standard GLP-1 coverage directly through their regular Part D plans. The government designed this bridge program strictly for folks who need the drugs primarily for weight management and who have otherwise fallen through the cracks of standard Medicare coverage.
Which brings us to Part 3, which medications are included?
Let's look at the actual drugs the government negotiated for this specific deal so you don't end up with any sticker shock at the pharmacy. The covered list is highly exclusive and limited specifically to weight management formulations. We're talking about Wegovy, both the standard injectable and the new oral pills. We're also talking about Zepbound, but with a major catch. It is strictly limited to the KwikPen formulation. If your doctor prescribes the standard single-dose vials or pens of Zepbound, no way, you won't get the discount. Finally, Eli Lilly's new oral pill, Foundayo, is also approved. But do you notice what's missing here? The massive names you hear literally everywhere, Ozempic and Mounjaro? Because those 2 drugs are FDA approved specifically for diabetes, they belong to an entirely different Medicare category and are explicitly excluded from this $50 weight loss deal.
Okay, moving on to Section 4, the crucial fine print.
Because whenever the government offers a $50 deal, you just know there are bound to be unique financial rules and firewalls built in, right? So, think of this $50 payment as living in its own isolated financial bubble, because it exists totally outside normal Part D structures. Your $50 won't help you meet your standard Part D deductible, and it won't chip away at your annual $2,100 out-of-pocket maximum. It operates completely independently. Furthermore, because the government already considers this a massive discount, you cannot stack other low-income subsidies like federal extra help or state programs like New York's EPIC on top of it. $50 is the absolute floor. And lastly, you can't stockpile these medications for the winter. You are strictly limited to picking up a 28-day or 30-day supply at a single time.
Finally, we reach Section 5, Taking Action with Your Doctor.
So you know the timeline, you know the medical rules, you know the exact medications. How do you actually get this rolling? Well, the best news here is that you do not need to switch insurance plans to jump into this. The path forward is pretty straightforward. You schedule an appointment, your doctor writes a bridge program-specific prescription, and then they submit the required medical paperwork. Now, the government has actually tapped Humana to act as the central processor for all of this, regardless of who your actual insurance provider is. And here's a massive pro tip for you. Print out the CMS prescriber guide and hand it directly to your doctor at your appointment. These are incredibly busy professionals, and handing them the exact operational framework will save them a huge headache and get your $50 rate approved much, much faster.
So there you have it. We've walked through the entire blueprint. The next step is really up to you. Review your medical records, check your BMI against those specific tiers, and have that conversation with your doctor today. Is this the program that finally bridges the gap between your health goals and medication affordability? It's definitely a fantastic short-term opportunity, but honestly, it leaves us with a massive question to ponder. If the government can temporarily cap these life-changing drugs at $50 a month right now, what in the world happens when the clock runs out on December 31st, 2027? Will this become the new standard of care, or will millions of people simply be priced out all over again? Thanks so much for exploring this with us, and we'll see you next time.